To improve the diagnostic and research capacity on the disease in Nigeria, a new equipment, covers 4,800 machine, which is the third in Africa after South Africa and Botswana, has been installed at the Nigerian Institute for Medical Research, Lagos.
You know, cervical cancer is a common cancer among women all over the world, and a virus contributes to the development of that cancer. There are different types of viruses, but in this particular center, the equipment that they've now installed would be able to tell them which types of viruses actually are in those samples and whether those samples are likely to be cancerous, so that women can get early treatment. Now, the implication of this is improvement in the quality of care, but also in our ability to understand, to do research. The Director General of the Institute, for instance, and his team will be conducting research in collaboration with other external partners.
Away from cervical cancer and still at the Nigeria Institute for Medical Research, the tuberculosis laboratory has been upgraded to biosafety level 3 to enhance research into multi-drug resistant TB.
Biosafety level 3 laboratory, that is one of the three in Nigeria, in Zaria and in Calabar, and then we have one now in Naima. And the essence is to be able to detect very early multi-drug resistant tuberculosis, because the cost of managing one case of multiple drug resistance is a lot, and we need to prevent it. So it's like tracking the treatment for tuberculosis. As you know, tuberculosis is a disease of poverty, and we have a large number of Nigerians who have tuberculosis, but it's a curable disease. Therefore, our component is, apart from researching, we should use the research findings to create awareness, generally, raise awareness among our people, raise awareness and advocacy among policymakers, so that the treatment prevention can improve the quality of life and prevention of the disease in our community.
An intervention cardiology surgery that involves operating the heart without opening up the patient has been carried out at the University College, Ibadan. 9 patients with complex heart problems had their hearts operated by a team of 5 cardiac surgeons from the Tri-State Cardiovascular Center in the United States, led by Dr. Kamal Adeleke. The Chief Medical Director of UCH Ibadan, Professor Temitokwe Alonge, described the process as a phenomenal achievement, adding that Nigerians can now come to the hospital for the management of complicated heart surgeries.
History has been made today in any public hospital in the history of this country. For the first time, we now have the ability to undertake cardiac catheterization for patients who have problems with their heart, with the intention of trying to prevent heart attack, and also to monitor those who already have what we call hypertensive heart diseases, to monitor the progress of the treatment being meted out to them. So it couldn't have come at a better time.
The team of medical experts comprising cardiac interventionists, pediatric cardiologists, catheterization and ICU nurses are expected back in Nigeria in August for another round of procedure, this time including children with congenital heart problems. And finally, in a program designed by the Anambra State government in collaboration with UNICEF and other development agencies to get feedback on the findings from the State Agency for the Control of AIDS, rapid assessment of health facilities, and bottlenecks analysis on HIV/AIDS prevalence in the state, coordinator has revealed that mother-to-child transmission accounts for the high prevalence of HIV in the state.
Found that there is limited access to HIV testing and care. In other words, the number of facilities that are offering HIV vaccine testing is limited, so there is need to scale up. We also found shortage of capable staff. We found limited laboratory capacity at the local hospitals. Actually, for laboratory staff, it was very accurate. We found that the record system was underdeveloped and there was weak referral system, both within facilities and between facilities.
All professional commitment or professional will We're also asking for that because we'll get political commitment. But the caregivers, those that are going to carry out the exercise, making sure that we realize our dreams as professionals. The pharmacists, the nurses, the doctors, the lab scientists will also want to extract this will from us, but I'm part of you, that what we have, we are empowered, we'll make sure that HIV/AIDS is good and paid.
For the Commissioner for Budget and Economic Planning and the State Governor, action is the word as efforts to get things right will be initiated.
When he first had the hint that this was bad in the state, he began planning along of what he's going to do in practically every health facility very soon. On our own part, the FDG program is already beginning to tackle the dilapidation. The way the government is now tackling the dilapidation in schools, I'm sure you all know what we are doing in the school system. We are also doing in the health sector.
I'm again challenging Dr. Dube. What my first sign is, I want to put money behind providing testing kits or whatever it is in every public and private institution in our hospital. If you bring it, what I can assure you today, that if you bring what it will take to do it today, I will deliver it in 90 days.
It opens with a gate of arts, moves into windows of creativity.
She finds the only English word she knows from somewhere hidden in the belly of a 4'9" body, and instead of "I won't get," she greets us with "bye bye."
Branches into rooms of color, and ends with a roof of imagination. Walk into Art House. The pieces all come together at 9:30 p.m. every Saturday. Art House, life is art.
The successful outcome of a pregnancy depends on a whole lot of factors, one of which is the care of the woman before pregnancy, during and after childbirth. The survival of the baby is also strongly linked to this factor. Antenatal care is crucial, but much more important is the fact that a woman needs to deliver where a skilled birth attendants are, with other life-saving commodities. Singing and dancing to start off the antenatal class. This part of the clinic program for the pregnant women is a form of physical exercise. Antenatal classes help many women prepare for birth and parenthood. Here, there are first-timers in pregnancy issues and, of course, those who have walked the road before.
The basic thing, from their own care to the care of the baby, to what to expect, to labor, in fact, everything we have to teach them from the beginning. The first time, even the ones that I've been having, sometimes you find out that by the time they finish that, they've forgotten everything. They come again. So sometimes we just put everything together, put them together and teach them. They are supposed to come with their spouses, because their spouses should be part of what we are doing. They should know what is happening to their wives. So we put them through, we tell them and display to them, tell them to encourage their wives.
Now settled for the day's business, the nursing officers give various advice on how to achieve good health for both the mother and child during pregnancy.
What you eat is what will go into your baby. And so because of that, you need to eat well. And eating well does not mean eating expensive food. Eating well means that you eat food that is rich in all the nutrients, that is all the things that you need. We have different categories of food. We have the one that will give you and your baby energy. We have the one that is for growth. That one, the one for energy is carbohydrates. Then we have the one for growth.